Welcome to Monday evening here in Franklin, Tennessee. Hope everyone is well while I get set up here and get everything rearranged. My name is Cory Calendine. I'm an orthopedic surgeon. I practice in Franklin, Tennessee. I live in Brentwood. That's where we are coming to you from today, as silly as that sounds. Little rabbit in the backyard. Welcome in. Again, Cory Calendine is my name. I focus my practice largely on hip and knee replacement. I'm an orthopedic surgeon, but I spend my elective practice in hip and knee replacement. I want to talk to you guys a little bit today about the Subvastus approach to knee replacement. There's a ton of marketing and information out there, and I think, quite honestly, patients are kind of getting confused. I actually like it when people come to me, they're interested about their care, they're investigating it on their own. Sure, it can be at times overwhelming when people Google and ask me 1,000 different questions. I'm normal too, but the reality is I would opt for people that really do take interest in their care, that really do want to understand their knee replacement that we're going to talk about today, because knee replacement is a huge decision. You know, just as a way of introduction, knee replacement is the only cure for arthritis. Now, arthritis, people say, they say, oh, I have arthritis, like it is something. Arthritis is the absence of something. Remember, arthritis is the wearing away of normal cartilage that occurs over time. That's wear and tear or degenerative arthritis. But no matter what caused it, wear and tear or inflammatory arthritis like rheumatoid arthritis, arthritis is the absence of normal cartilage. So once that cartilage is gone, you're bone on bone, that's a huge problem. And in the knee that we're talking about today, knee replacement is the only cure. So knee replacement is the only cure for arthritis, and that's what we're going to talk about. Subvastus knee replacement. We're going to explain it. We're going to talk about robotics. We're going to talk about some questions that come up all the time around jiffy knee. So maybe you've heard that term. We'll go one by one. First of all, what is the Subvastus approach? Now, we talked about knee replacement is if you have arthritis, you're bone on bone, you do knee replacement. That's metal on the end of the femur, metal on the top of the tibia, and a plastic piece in between. So instead of bone on bone, you end a total knee with metal, plastic, metal. So there's no bone on bone anymore. And you can have arthritis in a joint that's been replaced. People don't realize that. But a knee replacement is the metal parts. You with me? Subvastus is the way you get there. So it's kind of like what you do with the muscles in order to gain access to the knee joint. So in the hip world, this has become a very popular discussion. People talk about the posterior approach. This is getting to the hip through an incision kind of over the side of the hip and you going through the back, or an anterior approach where you make an incision in the front of the hip and going through the front. Well, this is a similar concept with knee replacement now. So a standard knee replacement we typically think of as a medial parapatellar approach. So what you do is you open the joint along on the inside actually of the patellar tendon, go around the kneecap and go slightly into the quadriceps tendon. That's standard. That's a medial parapatellar approach, and most total knees are done through this medial parapatellar approach. But what we're talking about today is the Subvastus approach. Now, in fairness, it's nothing brand new. We've been looking at this approach for years and years. In fact, it was quite popular probably 15, 20 years ago, but it's making its way back, and I'll talk about that. It's making its way back for many, many different reasons. So the Subvastus approach goes underneath all the muscles of the quad and does not extend into the quad tendon. Again, the quad muscle has 4 different muscles. So the one on the inside, the vastus medialis oblique, usually in a standard total knee replacement with a medial parapatellar approach, we take that VMO. So we take one of the 4 muscles of the quad off the tendon. But in a Subvastus approach, we do not put our incision up into the quad tendon, but instead go underneath the vastus medialis oblique muscle. So that takes all 4 parts of the quad muscle and slides them to the side. So the concept here is less soft tissue damage and hopefully a more normal feeling knee and faster recovery. So the Subvastus approach leaves all 4 quad muscles intact to the tendon, so there's no cutting of the tendon. You go underneath the vastus medialis oblique, which is the inside quad muscle, you pull them all over, voila, knee replacement. So the knee replacement parts are essentially the same. You might say, well, if the knee replacement parts are the same, isn't the surgery the same? Well, this difference in how you handle the muscle underneath the skin is so important. Now, sometimes people do a subvastus through a midline incision, so a straight knee incision. You've probably seen a lot of those. But now I'm doing a subvastus approach through what's called an oblique incision. So it's a little bit more on the medial side. It's off the front of the knee, makes kneeling a little bit easier. So subvastus knee replacement is a way to do a knee replacement with less soft tissue damage. That's the goal. Faster recovery, less pain, that's the goal. And I do it robotically. So not only do I try to take care of the muscles, but I'm trying to take care of the bone too. Before a knee replacement, I actually do a CT scan, create a custom 3D model of the knee, and I use the software, the Mako software. So maybe you've heard about Mako Arm Robotic-Assisted Knee Replacement. That's what I use. And so I have a preoperative CT scan that shows me the bone. I use that information in a robotic arm for precise bone cuts at the time of surgery. And now I'm using a subvastus approach to the knee, so not having to cut any muscle, come underneath the quad. I think this is going to be the ideal approach for my patients. And certainly if you have questions or comments, by the way, let me know down at the bottom. So subvastus approach goes by many names. You've probably heard people say sub-V. So we just short it, subvastus. Again, that's underneath the vastus muscle. All the quads are intact. And we talked about how it's different than a traditional approach. But I get this question all the time. What about the jiffy knee? Jiffy knee. Remember, we said traditional knee replacements are metal, plastic, metal. Well, all knee replacements are metal, plastic, metal. So is the jiffy knee. But the jiffy knee concept, and everything I know about the jiffy knee concept is just what's available online, but it does utilize this subvastus approach. Now, jiffy knee is a branded term. It's a trademark term. It's actually filed with the Federal Trademark Commission. So the owner of that brand has attached a brand name to essentially a knee replacement that's done with a subvastus approach. So I think the traditional jiffy does not use robotics. So for me, I'm sub-V with robotics. So I'm not a jiffy surgeon. I have not trained with the gentleman that owns that brand, but instead I do a subvastus approach with robotics, which I think is a pretty clear enhancement of the procedure. So careful soft tissue handling, careful bony handling. I think that's the key. So there's no peer review literature on the jiffy knee. The jiffy knee concept is not fully, I think, publicly aware, but my understanding is it's a subvastus approach. And I do get those questions. So the goal would be less pain, less swelling. We already have our patients up and walking the same day. We've done that with conventional, traditional knee replacements, even before robotics. But now we've added robotics, which helps, and now we're adding subvastus. So it's really just that continual improvement, trying to get better and better and better. So why is the approach not standard everywhere? I get this question all the time. Well, it is technically a little bit more difficult. So because you're keeping all the quad muscle together, so all four muscles of the quad, especially in males that have big, bulky quads, it can be technically difficult during the surgery to carefully mobilize the quad muscle away, right? You still need access to the knee joint. Now, I've done some specialized training. Obviously, all I do is hip and knee replacement. I do about 800 a year now. And so doing more and more, seeing more and more, getting some advanced training allows me to be able to perform this perhaps more complicated technical surgery in a very safe way for the patient. So not everybody does it because, quite frankly, it's technically more difficult. We talked about this earlier, but I see the comments coming along. You know, there is some confusion in the market. What is a jiffy knee? What is a subvastus knee? Now, again, jiffy knee is a brand name. Someone owns that trademark. And one of the tenets of it is a subvastus approach, not robotics. So for me, I'm a sub-V knee with robotic approach, which I think is a further enhancement. If you have questions, certainly drop them in the comments. Okay, so a good question. How can you find out which knee replacement is right for you? Now that's a critical question. I said earlier, I think it's really important to do your own research, and that has to be within reason. You need to find a surgeon that you can trust. I think that's so important. Sorry, I was just reading some of the concepts. I think it's so important to find a surgeon you can trust. Remember, we talked about the advantages of a subvastus knee replacement. There's no cutting of the muscle, no cutting of the tendon. It's muscle sparing. You take all 4 quad muscles, leave them intact to the tendon, slide underneath or underneath the vastus medialis. You get in through the inside of the joint. So you go underneath the vastus, pull all 4 quad muscles intact with the tendon. There's less muscle damage. There's hopefully less swelling, less pain, and a more normal feeling knee after surgery. So those are the big advantages to subvastus. I think the key is combining that with robotics. You know, we talked about why doesn't everybody do subvastus? It can be technically more difficult. The visibility in some ways is a little bit less, particularly early on in the experience. One real power of robotics, however, for me, is I have a preoperative CT scan that shows me the individual patient anatomy in great detail. So I create a custom 3D model for each patient. I use a robotic arm with a saw that's controlled to protect the soft tissues. So obviously, I want to see all the elements of the anatomy. I think that's so important. But having a robotic tool that is also precise to minimize soft tissue, I think is just that further enhancement of what we're trying to bring. I appreciate y'all making comments in the comment. Appreciate all your nice words. What if I took the marrow out of my bone? Yeah, don't do that. You don't want to eat marrow. I think some people do. Think that there are healing properties to marrow of animals, not of humans. I would never recommend that. But marrow elements, largely in our bodies though, as adults, the marrow is largely just fatty tissue. When we're younger, it's more involved in like red cell generation. But as we mature, there's really not a ton in there. So if you know someone who is considering knee replacement, feel free to reach out. You can follow me on many different platforms. I think there's a ton of information there. Or obviously, I'd love to see you in my clinic. I work at the Bone and Joint Institute of Tennessee in Franklin, Tennessee. You can call the office. It's 615-791-2630. Ask for me. I'd be glad to talk to you about subvastus knee replacement or your hip. I also do a ton of hip replacements. We're going to talk about a lot about that in future videos. Certainly, you can go online. If you check, there's a link. You can make an appointment online if that's easier for you. So I hope you enjoyed our few minutes together talking about subvastus knee replacement. Explained. We talked about some of the questions around Jiffy knee replacement. There's a lot of consumer confusion around Jiffy, so hopefully some of those things are cleared up today. Let me remind you, feel free to like and subscribe and comment and all those other things. Even after we come off the live, I'll be tracking these comments. So if you have a question or concern, I look at all of them myself. Feel free to ask a question. I'll try to get to it down the road. A couple more questions from the comments before we leave. Hello, sir. I just got an ACL surgery about a month ago. I'm walking in a knee brace. I hear noises, clack, clack sound. Yeah, early on, there can be, well, initially, I guess there can be air in the joint, but that should be gone at a month. But early on, when the muscles are weak, the knee will kind of slide around a little bit. There can be fluid in the knee that makes noise. I wouldn't be too worried about sound per se. Certainly after ACL reconstruction, as is true of every orthopedic surgery, follow your surgeon's recommendations. They know the nuance, the details of your individual surgery. They know when you can walk, how much weight you can put on it, and all those things. So be super, super careful, particularly in the early post-operative period. If you have any questions, I hope you'll reach out. Call the office, make an appointment online, find me on social media. I'll check all the comments. Again, subvastus knee replacement explained. Okay, guys, thanks for your time. Subvastus knee replacement with robotics. Again, subvastus knee replacement with robotics. I think that's the future, and the future is now. I'd love to talk to you more about it. If you have any questions, reach out. Have a great night.